So, should we be taking aspirin to prevent heart disease? This is Diamond Fernandes, your founder and director of the Heartfit Clinic, and today I'm going to talk about aspirin. And I'm a big fan of medications early on in a disease process, but after that, it's about applying the principles that we focus here on the Heartfit Clinic to help you live, obviously, a good quality of life. And so, there was an article that just came out in 2019, and it was and actually they were looking at a whole bunch of trials from 2018, so there's a whole bunch of retrospective trials, and they were showing that whether we should be taking aspirin because of the risks that can come from it. In all honesty, I think if aspirin were to come on the market as a medication today, I don't think it would pass the trials that we'd want us to see on what we see for medications today. So it would not be an over-the-counter medication, that's for sure. So with that said, I think about 30 million Americans are taking aspirin a day to prevent heart disease. And I think a fifth of them, or 6 million of them, are taking it without a doctor's consent, meaning that pharmaceutical companies are doing a good job on advertising to take aspirin to prevent heart disease. Now let's talk about that for a second, because in the event that you are having a heart attack, it's important to take aspirin. But to take aspirin to prevent a heart attack doesn't really happen. And so the benefits of taking aspirin is that it thins the blood and it prevents the blood. If you have that pimple that pops inside your artery, that's a heart attack. Well, aspirin thins the blood to allow to prevent a thrombus or a platelet aggregation. I'm trying to speak in layman's terms, but the buildup of blood clotting at that junction. So basically, taking aspirin thins the blood, and that's a good thing. Now, the bad thing, it's got an immense amount of bleeding risk. And so if you do not have cardiovascular disease, now the consensus came up where if you are 70 years, or people with increased bleeding risk, you should not be taking aspirin. And here's the problem that I have with it, is that it's, when we look at aspirin, it thins the blood, and 90% of diseases start in your digestive tract. And so when you're taking aspirin, it thins the blood, and therefore it can also cause problems in the GI system. So as an example, it can cause bleeding internally. Number two, it can cause ulcers. And now you got these ulcers, you got this acid reflux, and now you're taking a ban of acid reflux, and that's another post altogether. But sorry, I'm not a big fan of acid reflux medications because it affects the arteries in a bad way, but that's another post. Getting back to the aspirin side of things, it's just not, I just don't see the reason for taking an aspirin to prevent heart disease. Now, with that said, if you've not had a heart attack and you're deciding to take aspirin, this is where it's important to talk to your healthcare provider or us at the Heartfit Clinic and help you understand whether that is a good option for you. But according to this data, hopefully you understand when and where to take it. So I am not a fan, for sure, taking aspirin to prevent a heart disease if you've never had a heart attack or stroke. On the second camp, if you have established disease and you've had a heart attack or are susceptible to one because you've had a stent or whatever it might be from that end, now it might be a benefit to take aspirin, but again, that's a talk to have with your healthcare provider. So I'm more a fan on that side of the situation versus if you've never had a problem in the first place, now taking aspirin, it just thins your blood. And so it can cause a myriad of other concerns, as we are seeing in the studies now. So this literature just came out, and so I'm sharing it with you, and look forward to helping you live happier, healthier, and longer. Make sure you hit the subscribe button below, and look forward to our daily updates.